رمضان طبيبي، معناك جليل بقلب جميل، يحوم النور بأنحائي، يحوم النور بأنحائي.
الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وأصحابه أجمعين. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome once again to the series on the medical fiqh of fasting. And today we will be starting with part 5 of this series. In this part, we will be discussing how do you judge the fitness to fast. So a person who has some sort of chronic illness or some sort of illness, and they are willing to fast, how do they go about judging whether they are fit enough to fast or whether they should not fast? This is obviously from the medical standpoint. So generally, people make this decision on the unfitness for fasting based on three situations. Firstly, they had an exacerbation of their symptoms. This may have been while they're currently fasting or previously, or there's been knowledge of exacerbation of symptoms given to them by someone else. And an example of this is an asthmatic. So somebody may have started their fast and their chest became tighter. And as the fast went on, they were unable to continue fasting because of the exacerbation of the wheezing. So this would be an exacerbation of a condition that led to the person not fasting. Secondly, a person who is deciding not to fast or feels that they are not fit to fast have been given advice regarding their condition from a healthcare professional. Importantly, ideally, this advice should be given by a Muslim expert in the field. He should be an upright, pious Muslim professional who would be advising on this situation. Often we know, and we are obviously in a situation where there is no expert in the field that fits that criteria. He may not necessarily be a Muslim or a pious, upright professional. However, it's important to consult with an expert in the field who is sensitive to the aspect of fasting. And finally, often we have personal experience. A person has tried fasting before, and every time they do fast, they experience major problems. And the provisor to all this is that this must be a predominant probability of harm to the person or his well-being. So it's not based on a sort of flimsy idea that it may cause harm to them. It's based on a solid predominant probability of harm. So how the fuqaha and the jurist and the ulama would look at it, and this is all derived from the books of fiqh. The first question and the first thing that the fuqaha would look at is there worsening in the physical condition. Secondly, by the person fasting, would this delay recovery of whatever condition the person is suffering from? Thirdly, if it's with regards to a mental condition, is there going to be worsening of the mental condition? And finally, in a pain syndrome or a pain condition, will that exacerbate or will the pain get worse by the person fasting? And if the pain gets worse, is the patient able to continue fasting? So this is how the ulama would look at it. And the question then is, to what level would a worsening of the condition or the slowing down of recovery or the worsening of pain and that sort of thing be considered as a trigger for not fasting or for the ulama ruling that this person should not fast? And it's all based on this aspect of haja, that haja meaning that a person's daily important activity is hampered. So somebody who does, for example, cooking every day, and it's essential part of their daily routine, they are hampered in the ability to do that due to their condition being worsened by fasting, then this would be considered a condition that would help the ulama decide on whether the person should fast or not. So there is a lot of discussion between the medical practitioner and the ulama with regards to each person's unique situation on fasting. Some of the examples I've listed here are those who generally fit into this category and ask these questions. Firstly is an asthmatic, somebody who has asthma, and we all know that an asthmatic can either be a very well-controlled asthmatic or a poorly controlled asthmatic. This is mainly directed to those asthmatic patients who are poorly controlled. They have frequent need for relievers and nebulization. These type of patients generally ask the question on whether to fast or not to fast. Secondly, we have people who have a chronic pain condition, such a condition that requires regular pain medication to be taken orally to keep them functional during the day. Thirdly, we have the frail and elderly. And the fourth patient is that of a cancer patient, someone who is diagnosed with a cancer. And we know, again, a person who has cancer can either be in an early phase of the cancer or in a terminal stage of the cancer. And finally, we have the diabetic patient who is on insulin. They are the conditions. However, these are the common ones, and the scope of this discussion doesn't allow us to go into details with regards to all of them. But it's important to understand a few important principles. Firstly, in all situations, the first point of call would be the medical expert. Each person has an individual condition that is specific to them, and they need to discuss this with their medical expert. As we explained before, ideally it would be a Muslim professional who is upright and who's pious, who's understanding of the needs of the person. And importantly, after this discussion with your medical expert, the discussion can also be had with your mufti. It should have read the mufti, the local mufti, or the alim in your locality. And after discussion between these two, a decision whether to fast or not is made. Especially for the diabetic patients, which are a very large group of patients that undertake fasting. And there is a DAR calculator on the net. This is particularly helpful for the practitioner to help stratify and decide which patients are likely to be able to fast and which patients should not be fasting. So inshallah, this is just to give you a brief overview on what the mindset and the thinking is before a person embarks or decides not to fast when they are suffering from various medical conditions. And this should not be taken lightly and an individual decision, but it should be a team decision between the medical experts and the fuqaha. This is the end of the part 5, and inshallah we will meet you at part 6 inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
حبيبي بالأنس وأنت الكون